Hello and welcome. It's 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you the latest live briefing from the South Korean health authorities on the COVID-19 outbreak here in the country. And in just a few moments, we're going to cut into the briefing at the Sejong government complex with simultaneous interpretation for you available in English. And Song Young-le, the Director General of the Central Disaster and Safety Countermeasure Headquarters, will be briefing us on the coronavirus situation here in South Korea. And the briefing will give us an update on the number of new infections as of Tuesday midnight, as well as any trends and the latest on the vaccine rollout. So we have just gone into the briefing room. Let's take a listen.
Let us now begin a regular briefing for August 3rd, Tuesday, and our quarantine officers have talked about the quarantine measures to be applied at the correctional facilities. And after our latest outbreak in the Seoul's detention center, we are seeing a stabilizing situation, COVID-19 situation centering around such correctional facilities. And the Ministry of Justice is also having a task force which is supervising the COVID-19 situations at these detention centers and correctional facilities nationwide. And all of the new inmates, they are currently under a 2 weeks quarantine when they are first admitted. And all of the workers there are mandated to wear face masks. However, we have seen a spread of the local cases, local community cases, and we have seen some cases of small sporadic cluster infections centering around the workers who have been infected by their family members. And to this end, we will also implement a high priority group of a vaccination program for the workers who are working there, and also the high risk inmates who will be vaccinated as a priority group. And we will also carry out temporary and also on a regular basis, we will carry out such on-site inspection and monitoring, and the quarantine officials will continue to exert our full efforts going further. And also during the past month or so, we have been looking at the public survey on their awareness of the quarantine measures. Amid the fourth wave unfolding here in South Korea, about 28.4% of the respondents said that South Korea is safe over the COVID-19 infections, which has been a decline by 23% from the previous month. And also, we have seen more people, about by 11%, who have answered that they are depressed due to the prolonged COVID-19 outbreak. And we also seen about 6.8% increase in the number of respondents who answered that they will get vaccinated if they haven't been so yet. And as for the fourth wave, the level, intensifying the level 4 distancing measures, many of the respondents said that they have agreed on such measures. And as for the timeline of such antivirus measures, many of them, also about 15%, said that these measures should go until August 8th, and about 25% answered that they should go until the end of September, and also 23% of the respondents said they should continue until the end of October. And we have also asked these respondents of treating these COVID-19 patients with light or moderate symptoms at home instead of having them admitted to life treatment centers. And as for this question, about 75% have agreed on this. And to this end, we will be opening our ears to the public's opinion, and we will devise necessary policies going forward. And today, we have seen 1,152 new local infections and 50 new imported cases. And we had 5 new additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And as for the COVID-19 hospital beds, we have currently 4 42% of our hospital beds available for immediate use. And as for the ICU beds, we also, as for the COVID-19 hospital beds for moderate and symptoms, we also have about 2,000 beds available right now. And as for live treatment centers, which are treating these light symptom patients, we have about 45% of these capacity for immediate use, which is about 7,000 hospital beds right now. And as of yesterday, we also had 473,000 people, more people receiving their first dose. And this is about 38.8% of the total population who have received their first dose, amounting to about 19.9 million. And we have 7.18 million people who have been fully vaccinated. And starting from yesterday, we also have been opening our reservations for the COVID-19 vaccines for the seniors who have not yet gotten their vaccines. And if you book your vaccines, starting from the 5th of August, you will be receiving the AstraZeneca vaccines. However, if you do not book your reservation, you will be given the COVID-19 vaccines in October. And we also have seen that in the months of May and June, about 96% of the patients were those who have not been vaccinated. And as for the fatalities and also critically ill patients, we reported that 93% of them were not vaccinated. So please note that vaccinating yourself could help you to lower the risks of COVID-19 infection and also the severity of the symptoms and also fatalities. So we ask you to participate in the vaccine rollout. And starting from today, we will also have the local governments give out their priority group the vaccinations, and this will be also given to about 2 million people nationwide. And also we will be opening our reservations for about 17 million general public between the ages of 18 to 49. We will be receiving the bookings first and then also inoculating them as soon as possible. And please note once again that vaccinating yourself can reduce the infections risks and also lower the risks of developing severe symptoms and COVID-19 deaths as well. So we ask for your continued participation. Moreover, we are in the midst of the fourth wave, and it is very fortunate that we are not seeing an expansion of the scope of such a wave, and this is all thanks to your continued efforts and participation. However, just like the sports games where all of the athletes need to exert their full efforts until the very end of the sports game, we want to emphasize the need for your continued participation going forward as well until we have final control of the COVID-19 situation here in the country. And the vaccination rollout, if it carries out smoothly as scheduled, we believe that we will be lowering the risks of infection and the size and the speed of COVID-19 virus spread as well. Once again, I would like to extend my deepest appreciation to all of the people who have been inoculated so far. And also, even at this moment, there are many people who are exerting their full efforts at the forefront, including medical workers and also public servants and epidemiological investigators. The central government will also, together with the public, we will continue to exert our full efforts to overcome the fourth wave. Thank you very much.
네, 질의응답을 가지기 전에 브리핑 내용 중에 한 부분 정정하도록 하겠습니다.
That was a live government briefing on the COVID-19 situation here in South Korea that you just heard. And just to recap, South Korea reported 1,202 new cases of COVID-19 on Tuesday. 5 additional deaths have unfortunately been reported, bringing the total death toll to 2,104. We're going to wrap up our coverage here, but we will be back at 12 p.m. Korea time for our midday news with Mark Broom. Bye for now.